Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, and I'm very excited today to bring on one of our partners who is associated with Lee Health, Dr. Mark Bloomston with South Florida Surgical Oncology. How are you this morning, Mark?
I'm doing great. Thanks for having me, Amanda.
Now, I understand that you have some very exciting things going on with Lee Health, with the Regional Cancer Center at Gulf Coast Hospital. Do you want to talk to us about some of the things that you have going on over there?
Sure. I think that's an important part is this big move that we have undergoing a transition from the cancer center being mostly housed at Lee Memorial Hospital to now a new and exciting space that's been created at Gulf Coast Hospital. So it's been a labor of love for a lot of people in the community for a long time. We have felt after many meetings that this community could support even a dedicated cancer hospital. And that was coincided with the revamping and the expansion of Gulf Coast Hospital. So it only made sense that we incorporate this hospital within a hospital concept. And so now the Regional Cancer Center, which has been a freestanding building for many years, off of Colonial, where there's been chemotherapy and patients able to be seen, and radiation therapy, now has an inpatient presence and a dedicated hospital at Gulf Coast Hospital.
That's fantastic. Now, just to talk a little bit about your specialty, I know that you have a specific cancer that you attack, if you will. Do you want to talk to us about your specialty and what makes it unique?
Sure. I'm a surgical oncologist, so that means that beyond my general surgery training, I did dedicated training for cancer management. So not just operations, but the total cancer care for a patient. So our practice is mostly gastrointestinal cancers, in particular cancers of the liver and the pancreas. So probably the most common cancer that I deal with is pancreatic cancer. Of course, that gets pretty bad press these days for obvious reasons. But we have seen strides being made in the last few years, both from a overall global management of pancreatic cancer, but also just in the surgical techniques. We're now able to take robotic approaches to these cancers, doing major cancer operations on the pancreas and on the esophagus and on the liver using robotic techniques. So that may offer some advantage to certain patients. So that's something that we've introduced at Lee Memorial, and now that's going to follow us to our new cancer hospital at Gulf Coast Hospital.
That's fantastic. Now, talk to me about these complicated surgeries and the outcomes that you're experiencing, and how this move is going to improve that, or help stabilize it or keep it stable.
Well, probably really the poster child for a complicated operation has to do with pancreas cancer. It's an operation that many people know as the Whipple operation. It's the most common operation that we do. And here in our system, we do a very high volume of pancreatic surgery. So based upon that, we've built a really great multidisciplinary team that's able to get even the sickest patients through that complicated operation. It's an operation that takes 3 or 4 hours to complete. Patients are in the hospital for, on average, a week. So most are ready to go home before then, but we obviously have some patients that have to be in the hospital even longer than that. The patients that we do this operation on, even though it's a complicated and a long recovery, tend to still be elderly. And so a full 20% of the patients that we do these major operations on are over the age of 80. Which is kind of expected in this community, but those patients still enjoy very good outcomes. Our overall mortality rate for operations of that magnitude is 2.5%. So I expect patients to come through that operation safely. I expect them to make a full recovery and get back to a normal life and enjoying life while they can, because quality of life is just as important as quantity of life, in our opinion. Now, when we move this over to Gulf Coast Hospital, of course, we're bringing our team with us that we've trained for many years, and then also engaging the new members of the team that are already waiting for us at Gulf Coast. This has been something that's been coming on for a long time. So in the operating room, we've already had our nurses from Gulf Coast, and our surgical techs have been training with us now at Lee Memorial for many months. And we're bringing our robot, we're bringing our techniques, we're bringing our team, we're bringing all that to Gulf Coast Hospital with a new focus, with new technology, with the state-of-the-art technology in the operating rooms and the recovery rooms and the floors and the ICU. So we are all obviously very excited about this.
Yeah, it sounds like it's not just a new floor, it's a new cancer hospital within a hospital, right?
Absolutely, absolutely. And that's an important distinction because it brings a culture to that hospital that maybe didn't fully exist before. Gulf Coast Hospital has been well known, has been given excellent care for many years, and has been a staple of this community. But now to bring a dedicated cancer program into that hospital and almost as a freestanding entity to integrate with the people that are already there, bring new physicians in there, bring more patients in, and provide that cancer care in our community, hopefully even draw in from other communities. And we want to attract new talent, more doctors into this area, because who wouldn't want to live in paradise and treat cancer in this community?
That's fantastic. I love it. I really appreciate your time. And I love the community collaboration and the way that all of us here in Southwest Florida really do work together for the greater good. And this is just another community partnership showing that we're able to accomplish that. So I just want to thank you so much for your time, Dr. Bloomston. Thank you again. And I look forward to speaking with you again in the future.
Great, very much.